The term whiplash was first used in 1928 and continues to be used to describe common soft tissue neck injury. Dr. Dan Kwon of Desert Regional Medical Center in Palm Springs discusses what happens to the neck for a person who experiences whiplash.
Whiplash is often thought of as an injury associated with a motor vehicle accident where you're hit from the back and you have a flexion and an extension type of an injury where your neck is taken back and then brought forward in rapid succession, resulting in acute neck pain. It's quite a complex process of injuries that occurs with whiplash injury. Whiplash injury not only involves muscles and ligaments and tendons that can become injured, but quite often it's the joints within the neck that allow you to rotate and move your cervical spine, as we call your neck, that become injured with whiplash injuries. You do not have to be in a motor vehicle accident. You can be in a lot of different type of injuries. Roller coasters, you can be walking and you can be hit from behind. Any type of injury where we think of as a flexion and extension injury of your neck is thought of as a whiplash injury. Symptoms can range quite a bit. A lot of times after, for instance, the classic motor vehicle accident, people will feel kind of an achy soreness in the neck, but the symptoms can range from just neck pain all the way to radiation and referral pain to the shoulders, to the upper back, to the head. Headaches, neurological symptoms can even occur where you have tingling and numbness in the face, the neck, the shoulder. You can have a whole host of muscle spasms and other types of soft tissue pains and aches and so forth. And that's just to talk about the basic symptoms that can occur after whiplash. We classify whiplash into several syndromes. There's the acute whiplash syndrome, where you think of it as a common, occurs fairly soon after an accident, typically within a month or so, goes away and you're back to where you were before. And then we have chronic whiplash syndrome. That is something that develops in, fortunately, only a minority of patients, but this can be quite debilitating and quite persistent. And the chronic whiplash syndromes can last years, if not sometimes a lifetime in certain people. Depending on the etiology of in terms of what part went wrong. Oftentimes it's not just one factor that causes pain in a whiplash injury. It's oftentimes the joints in the neck, it's the muscle, soft tissues, and ligaments. And depending on where and what's going on as the primary complaint, we individualize treatments. For instance, if your head is turned a certain way and you are in a whiplash injury, you might hurt the right side of your neck a little bit more than the left side. And treating that side with focusing on the joints or coming to a proper diagnosis is actually more important than, or finding the diagnosis is quite important in treatment. Treatment includes, of course, the conservative measures with physical therapy, also medication management, anti-inflammatories, pain medications, muscle relaxants. Those are all common treatments that we use for whiplash. Some of the more advanced treatments include even procedural interventions, injections into the joints or soft tissues of the neck, treatment with even aggressive things like Botox or botulism toxin might be treated for neck pain. Seatbelts can help for back pain and other problems, can protect and save a life and that is quite evident in all the studies and statistics out there. But in terms of whiplash syndrome, it doesn't make as much of a difference. I think probably more of the factor is head restraint system. Having the head restraint system in the proper position is actually very important in reducing some of the symptoms. Of course, not getting in an accident is the best treatment, but once that occurs, once you've been in an accident, it's essentially treatment. Getting proper diagnosis, getting early treatment rather than waiting will help some of the long-term aspects.